We've been talking this morning about that socio-economic national strike action that has had little impact in many parts of Gauteng. Residents are continuing with their daily activities, with buses getting people to work and school as they shun the call to demonstrate. Two of South Africa's biggest trade union federations, COSATU and SAFTU, are leading marches and rallies across the country in this national strike. The federations called for a mass stay away, a move, if successful, likely to affect the country's struggling economy negatively, including the delivery of services. SABC News reporter Katlego Khodi is in Germiston for us tracking developments there. Katlego, when we last spoke to you, you were in Soweto where there was little activity. What's the case like in Germiston?
Most definitely, Desiree, we're coming to you live from the city of Ekurhuleni. Having started our day in the city of Johannesburg earlier on, we were in Soweto where we saw that it was business as usual, as you rightly stated there, where services, the education sector is concerned, with kids going to school and those educators also coming through to help them. As you can imagine, that we are inching towards the preliminary examinations, and most of the people in that education sector we're kind of skeptical about this national shutdown and how it's going to have an impact on them. But then now we're coming to you live from the Bethakowa Hospital. This is in the city of Ekurhuleni. This is where the essential services are being rendered here. The continuation of those essential services. We've observed and seen a whole lot of people just flocking here to get those services. Many have not hit to the call of just downing their tools, this including the staff complement of this hospital. We know that Gauteng province has about 370 clinics that operate here in the province, and about 36 hospitals that are fully operational, we are told today. But the person that is best positioned to give us an idea of how the socio-economic shutdown is impacting the health sector is Motalatale Mudiba. He's the spokesperson for the Gauteng Department of Health, who's going to just join us now and let us in on the impact of this national shutdown. Motalatale, there were concerns, especially from earlier on in the morning when there were news of this national shutdown in terms of how that is going to affect the provision of essential services. But I was just telling our viewers as well to say that that has not been the case. On the ground, we are seeing operations just going smoothly. We've seen the ambulances also just moving. Maybe give us a picture of how the entire province and the facilities, the health facilities, are looking this morning.
Fortunately for us, up to so far, services are continuing as normal. All our 37 hospitals are operating as normal. We also across our clinics, it's about 369 of them that are operational, that are continuing to operate as normal. In terms of the Gauteng emergency medical services, even just about 30 minutes ago or so, when we were doing a roll call checking with them, they were indicating that they continue to dispatch ambulances as normal. They are responding to emergency calls as per normal. So it looks like services across the health system continue to be rendered as normal. And I think you've seen here at Bethakowa Hospital, since we've been here for quite some time, since this morning, services continue. Patients are coming in, they are receiving their services. So far, there has not really been an impact in terms of disruption of services across our service platforms.
We know very well from that circular that was issued out that there are some shop stewards that have been given some time off to attend to these demonstrations, and some of the nurses and doctors belong to your Denosa, your Nehau. Have they also been given that will to participate in the strike action, or because they are providing essential services, they assist just to ensure that everyone is accommodated when they come to their facilities?
Look, the circular is very clear insofar as who is able to participate in the national stay away. We are, as health officials or as healthcare service providers, we are essential services. So all our essential services staff are at work. They are continuing to render services in compliance with the circular that has been issued by the DPSA. So we haven't experienced any challenges on that front.
And just a message finally from my end in terms of those people that may still be skeptical. We're going into the afternoon and we don't know how the shutdown is going to affect some hospitals and some parts of the Gauteng province, those people that are still skeptical and scared of visiting the facilities because of the national shutdown that is taking shape, what would be a message to them?
Look, I don't think there's anything to be really scared of. We continue to render services, as you have seen. Even now, as we're sitting here, you can see patients are actually busy moving in and out of the facility. So we want to encourage those that are due to receive whatever services, maybe they are scheduled for appointments at our facilities, that they should make their way to the facilities to be able to get their services, especially people that are on chronic medication and those that they are due for whatever services. It's important that they don't use this day to miss their appointments. We are here to continue rendering services to them. I think it's very clear that the national stay away, it's a peaceful stay away. It's not really interrupting services on the ground, and therefore we call on members of the public who are due to, or who maybe might want to come and receive whatever services at our facilities, for them to do so. We are open.
Thank you very much, sir. Matanatale Mudiba there, the Gauteng Health spokesperson, just giving us an idea of how this national shutdown is affecting the health facilities throughout the Gauteng province. You heard him saying there that they've got contingency measures in place and that their staff is at work, and that people that are maybe still shying away from visiting the facilities, those that may want to take a day off from taking their medication, they are more or less encouraged to visit the facilities. There will be people here that would accommodate them. And I must agree, Desiree, that indeed since we got here, we've been seeing ambulances coming in and out of the facility. We've also seen those patients are coming here to receive their services, and a word of comfort from the Department of Health in Gauteng to say that theirs is to make sure that they put the needs of those patients first. Desiree?
Thank you so much. There you have it, an update from Germiston in Gauteng.